Earlier today I was lucky enough to catch up with Tommaso and Ricardo Bartoletti and to talk about their work studying EAU Guidelines. Well, first of all, welcome and thank you very much for taking the time to talk to us today.
Thank you.
Thank you. So, let's kick off. Tell us a little bit about the work that you've been undertaking.
So we start with the question. The question was how we can reduce the prevalence of antimicrobial resistance and how can reduce the cost related to prophylaxis, to antibiotic prophylaxis, without have any impact on patient safety. In January 2011, we started a new protocol of complete adherence to European Association of Urology guideline on prophylaxis in urological surgery. We evaluate 2 years after the protocol and we compare this period with another period before the protocol implementation. We found important results and findings in the study. We found that the cost related to antibiotics was decreasing in the period after, and we found very interesting results in terms of reducing antibiotic resistance. In particular, we found the reducing of piperacillin tazobactam resistance and to antibiotics and to ciprofloxacin and to gentamicin. In particular, we found a reduction in cost and without any impact on patient safety.
From a clinical perspective, what's the importance of this work?
The clinical perspective is very good because these results can be used also by the general practitioners, for example. So the application of cost sparing for the use of antibiotics can be spread to all the different territories.
What's the next step with your work? Where do you take this from here?
The next step I think that should be an informative meeting with all general practitioners in order to diffuse the results of our study. Right. And in order to diffuse the acknowledgement and the good policy of antibiotic use.
Well, in your view, what's the takeaway message from this?
We should avoid the improper use of antibiotics in clinical practice. We have many reasons for this. In particular, the spread of indiscriminate use of antibiotic therapy also indicates that the antibiotic therapy is not necessary for the patient. The limited pipelines for the companies that are producing the antibiotics because the earnings due to antibiotic selling is not very good.
Well, both, thank you very much indeed for joining us. We really appreciate it. It's very interesting work. Thank you.